morning, everybody. My name is Leslie Ann Johnson. Welcome to this morning's post-cabinet press briefing. As usual, welcome to our colleagues joining us via Zoom, those of you joining us via Channel 22, the Facebook page, and of course the YouTube channel. We're always happy to hear from you. We have with us today the Honorable Minister for Health, the Honorable Nicholas Steele, Minister for Health and Social Security. We also have with us the Chief Medical Officer, Dr. Sean Charles, as well as Dr. Mayana Charles, Assistant to the Chief Medical Officer, and the Superintendent Vanny Kerwin in charge of community relations. And of course, the health officials will be talking basically about updating us on health and of course giving us the latest in terms of COVID. And Superintendent Vanny Kerwin will be reminding us of the rules and regulations. Now, we've started a little late this morning. We heard, of course, a while ago from the Honorable Prime Minister, Dr. the Right Honorable Keith Mitchell and Roosevelt Skerrit, and they were talking about the future of tourism in a regional forum. So now we're ready for the post-cabinet press briefing, and we will hand you over to the Honorable Minister Nicholas Steele. Good morning.
Good morning to you, Les, and to all of our viewers and listeners out there. It's indeed always a pleasure and an honor to address you all, although in most cases on some difficult issues. Let me start by saying that on February 12th, Grenada launched its vaccination program. February 12th, 2021. Between then and now, we have acquired and made available 52,000 doses of AstraZeneca vaccine for our population. We have made sure that there are sites all over the island, that the ministry continues consistently to provide the necessary information through social media, through printed documents, through sessions that we have had, either privately with private institutions or publicly, as we have had a couple Sundays ago. We continue to plead with the population to do what is necessary to protect us all. We have done very well, relatively, fighting COVID-19. The Ministry of Health has been able to keep as best as possible COVID-19 out of Grenada. And when it did enter Grenada, we were able to isolate it and prevent it from spreading. We continue to take all necessary steps, but we are consistent in our message, which is that the only way out of this is through vaccination, and that the vaccinations are available, the vaccines are available. However, what I would like to inform the public is that those 52,000 doses, we have used to date 19,000, just over 19,000 doses. That is with 13,600 people as of yesterday taking the first dose and 5,480 persons taking the second dose. On the 27th of June, all of our vaccination stock, remaining vaccination stock, will expire. We do not have, as yet, a confirmed source of replacement vaccines. And as such, we would like to inform the public, plead with the public. We know that there are many of you out there who are almost ready to take it, as you have been saying, who have been waiting to feel a little more comfortable. The facts are that if by the 17th of May, persons do not take their first dose, those of you who have been hesitating, we cannot guarantee that we will be able to give you your second dose in a timely manner. Because, as I said, the remaining vaccine stock will expire on the 27th of June. This is regrettable. We have fought a good fight with respect to informing the public, and all the information is consistent from the Ministry of Health, from the WHO, from the CDC. However, we have been fighting against other dissenters. We have seen certain religious persons going against their own religion and speaking from the pulpit a different message from what their own religion has said. And we have also seen many other religious leaders joining with us in seeking the best interest of our beautiful country, Grenada, and conforming with the message of their own religion. We have seen many trade union leaders assisting us in speaking out and supporting a vaccination policy while still supporting the right of the individual to take. But also we have not seen many others who remain silent, but they themselves in some instances have taken the vaccine. We have seen influential entertainers joining us and speaking to the public, encouraging our youth to step forward and do what is right, what is necessary. But regrettably, we've seen others speaking out against the vaccine. And it is against this backdrop that we regrettably have to say that the vaccines are still available. The vaccines have been available since February. The information is still available. The information has been available since February. But based on our current trend, we regret to inform that there may be some of you who, by the time you have removed your anxiety, by the time you have been able to dispel the misinformation that some dissenters have placed in you, that it may be too late. Also, consistently with our message, we cannot guarantee that we are going to be able to keep COVID-19 out of Grenada in the future. We have seen other islands and many other countries with much greater resources than us fail. And therefore, we have to face that reality. We look at what's happening with India. Our thoughts and prayers go out to them. They are the largest manufacturer of vaccines in the world. They have supplied us with the vaccines that we are using. And they have succumbed because their rate of vaccination within their public has been too low. Almost all of the individuals succumbing to COVID-19 now are individuals who are not vaccinated. And as such, again, we plead, but we must, in our efforts consistently to be transparent, we are informing the public that as of the 27th of June, the vaccine stock will expire, and as of yet, we do not have a replacement stock. Thank you.
Thank you, Honorable Minister. We go now to the Chief Medical Officer, Dr. Sean Charles. Good morning to you.
Good morning to you, and good morning to my fellow panelists and the listening and viewing audience. Last week, at the previous briefing, we highlighted to the public that this pandemic is far from over. We also highlighted the devastation that it is causing in many countries, both regionally and internationally. We spoke about the low levels of immunity in our population because we have not had any form of large outbreak, so members of our population, persons in our population, do not have natural immunity as a result of previous infection. We also have low uptake of vaccines. Persons are simply reluctant, maybe due to the confusion that has arisen as a result of all the misinformation that is being put out there. We also mentioned that in addition we have challenges with testing persons. When we identify persons that may be at risk, some of them they give us quite a challenge to actually get them testing. We also mentioned the reluctance of persons to follow the basic public health guidelines, the wearing of the mask, the sanitizing, distancing, which is evident everywhere you go, literally. And we concluded that we had all the right conditions for a massive outbreak here in Grenada. Well, this week we continue. All of those issues that we mentioned continue. But in addition, and I'm sure that many persons in the population have observed this for themselves, that right now we are experiencing a dramatic rise in the number of acute respiratory infections. It has affected many schools, business places. We are seeing absences and sick leaves as a result of this. We have noted that the number of cases of acute respiratory infection are progressively and steadily rising. We have started testing to verify whether this is as a result of COVID or not, and so far, cases tested have been negative. However, this is a signal, all right? This is a signal to us that we are headed down a very worrying path. It means that we have simply let down our guard, and in the event that a single case of COVID escapes all of the measures that we are presently taking, if a single case escapes, it could be from an illegal border entry, it could be from otherwise someone who, after finishing our screening procedure, they present very late, because this does occur. It means that we will face the same consequences that we see in other countries. Now let me just give you some numbers, because I am sure that many persons can relate to this. So we are in week 18 of the year. Let's go back to week 16. In week 16, we recorded 26 cases of acute respiratory infection. Week 17, we had 46. And in week 18, 133. You can see the numbers for yourself. These are cases of acute respiratory infection. For those of you who might be confused of what I'm speaking about, I'm talking about the flu, the same flu that is circulating right now. All right, persons come down with fever and sore throat and runny nose and headaches, and they feel unwell. It is affecting many persons in society. It's affecting our school children. It's affecting adults. It is transmitted in the exact same way that COVID is transmitted, through droplets that are spread when persons cough and sneeze and talk and laugh and so on. And it is also transmitted by contact, when your contaminated hands are brought to your mouth, your eyes, and your nose. Now, we're talking about 133 cases this week. Last year, this same week, it was only 21. All right, it was only 21. So something has happened. Somehow we have given this virus, because it's caused by a virus, we have given it the opportunity to spread from person to person easily. All right, and it's affecting us. So right now we just want to urge everyone, there is still time to change our fate. There's still time for us to do the right thing. We want to encourage everyone to obey the public health protocols. Hardly anyone is wearing masks in public anymore. It's as if we are not even in the midst of a global pandemic. Obey the measures that keep us safe. Obey the measures that is keeping many of us alive, because I am sure, as I said, if a single case of COVID escapes our glance and the disease is established here in Grenada, some persons listening to me right now will not make it. So these measures are keeping many of us alive. And of course, for all of the persons who are eligible, there is still time to get vaccinated. Do not give up on an opportunity to protect yourself and to probably save your own life. This is the time for you to take that opportunity and do something to protect yourself. All right? Afterwards, when we are looking back in hindsight, everyone has 20/20 vision. In hindsight, we would say, if we end up with a situation like as is occurring in many countries, in hindsight, I can tell you exactly what is going to be said. If you die from COVID in Grenada, you had ample opportunity to get the vaccine before. So you should not have suffered that fate. So we want to encourage everyone, do the right thing. Protect yourself. Thank you.
Thank you, Dr. Sean Charles, Chief Medical Officer. We go now to Dr. Mariana Charles, the Assistant to the Chief Medical Officer. Good morning.
A pleasant good morning to the viewers, the media representatives, and the rest of the panelists. I will go straight to give you an update on our current situation in Grenada as it relates to COVID-19. To date, Grenada has recorded a total of 161 COVID-19 cases, of which 159 has recovered. There has been a total of 6 hospitalized cases and 1 death. There is currently 1 active case on island who is currently in isolation. There is now 387 persons in quarantine. 28,568 PCR tests have been conducted, and just over 19,000 AstraZeneca vaccine doses have been administered. Of that, over 13,000 persons have received their first dose, and over 5,000 persons have received their second dose. Now, globally, over 1.2 billion vaccine doses have been administered, and there has just been over 158 billion confirmed cases of COVID-19 with over 3.2 million deaths. Additionally, we are now seeing a plateau of the number of cases and deaths globally in most regions. However, COVID-19 remains a serious threat. The spread of variants, the relaxation of public health measures, that is wearing of the mask, sanitizing, hand sanitizing, and social distancing, and low vaccine uptake continue to drive transmission. It continues to drive deaths, hospitalization in some regions. And we can see examples right around us. How quickly the pandemic ends depends on each and every one of us. We all have a personal responsibility to protect ourselves. It depends on vaccination. It depends on the level of vaccination and the uptake in our country. It also depends on the proven public health measures, which I've mentioned before. Proper wearing of the mask, hand sanitizing, and social distancing. Now, the good news, Grenada have all of these tools available. We have vaccines, right? We know what the public health measures are, right? So we have access to the tools to protect ourselves, to protect our loved ones. We all have a role in the fight against COVID. Now, Grenada is not out of the woods. Yes, we have done an exceptional job thus far. However, we remain vulnerable. Remember, a large portion of our population is still not protected. As Dr. Charles mentioned earlier on, we have only recorded 161 cases, most of which was imported. What does that mean? When we talk about natural immunity, just about 80% in our population has natural immunity, and only over 5,000 have been fully vaccinated against COVID-19. So do the math. Only over 5,000 persons have full immunity to COVID-19. That is significantly low. If COVID was to seep through our borders or come here, or variants were to come, it will be a disaster. Right? And we can see the examples right around us. Now, our population remains vulnerable. 1, because of the low vaccination. 2, because we have let our guards down. We forgot the public health measures. So today, I want to encourage everyone. Let us use the tools to protect ourselves. The tools are available. We have access to them. So let's get vaccinated, 1, but also let us continue to follow the proven public health measures. All right, so we can continue this good fight against COVID-19. Thank you.
Thank you, Dr. Charles. Colleagues, we go and viewers, we go now to Superintendent Vanny Kerwin, who's in charge of community relations, and of course, he'll be reminding us of the rules and regulations. Good morning.
Thank you very much, Leslie. Good morning to members of the media and Grenadians here in Grenada and in the diaspora. You may have heard my message several times over the last year, and if you're new to it, I ask that you pay attention. And if you're familiar with it, I hope that you will take some of the reminders that I'm going to be giving you this morning. You know, though we are fortunate as a nation to be almost COVID-free, and the assistant to the chief medical officer has indicated that we only have 1 active case, yet many of our neighbors are struggling to contain and manage the virus. Next door to us, Trinidad has totally locked down the borders. St. Vincent, while dealing with the recent volcanic eruption, have had to still deal with outbreaks of the virus. Schools in the Bahamas have had to close. We have been hearing of various variants and possible mutations. In recent times, we have announced that we have arrested and charged several non-nationals for entering our country illegally, coming from some of these countries, and they continue to come evading our established ports of entries. Here in Grenada, and Dr. Charles alluded to that fact, we have been witnessing on a daily basis our citizens traversing the country without wearing masks, particularly on those crowded buses. We have been seen gathering in groups outside of the stipulated numbers without permission. Businesses and individuals hosting activities without the relevant permission. Bus trips have become common across the country. Village shops are opening well beyond the stipulated time and are not adhering to the protocols regarding the number of persons allowed to be inside at any given time. And we have seen many other violations. Those were just a few. While we welcome the return of economic activities to the country, we must all be reminded that we are still under a state of emergency. And I want to reiterate that fact. Grenada is still under a state of emergency. Therefore, the IGPF as an organization must ensure that we do all within our powers vested in us to keep Grenada safe. We therefore will be stepping up our enforcement of the current regulations. We have exhibited immense tolerance and patience because we understand people's need to be free as they say. But times are again getting dangerous in light of what we have heard this morning about the vaccines soon to be expired and the amount of persons that have not been vaccinated. As these times get dangerous, we must act in the best interests of Grenada. I want to just reiterate some points that we have been saying over the last years. And I just want to be able to arraign some of the ignorance that we have been hearing from business communities. You know, there has been some confusion in the minds of many of our citizens that curfew starts at midnight, but the police are telling businesses that they must close at 10. I want to make this categorically clear, that it is not the police that determine and dictates that businesses close at 10. It is Section 6.2 of the regulation that mandates that businesses close at 10. So I just want to make that point, abundantly clear to business people. It is our responsibility to enforce the law, and enforce the law is what we will do. And they're gentle reminders that we have been providing to the public. And when it's time for us to act, we will act in the best interest of Grenada. And we are not acting outside the remit of the regulations. We are enforcing Section 6.2 of the regulation that mandates that businesses close at 10. Fortunately, though, We have had a recent amendment of that regulation that now mandates that businesses close at 11 p.m. for businesses that are qualified. And I want to make that distinction, and I want to make it abundantly clear. It seems to us from law enforcement that because the regulation said before that businesses must close at 10, all and sundry business thinks they have the right to open until 10. That is not the case. In the case of liquor shops, under the Liquor Dealers Licensing Act, that act provides for businesses or liquor shops to close at 9. So notwithstanding the fact that the law says or the regulation says businesses closes at 10, it does not necessarily mean all business opens until 10, when there is a law that mandates that liquor shop close at 9. And so we expect that those businesses should close at 9, and that is why I indicated that for businesses that are qualified, they can open now at 11 with the amendment that has just been passed. To provide some general reminders, we urge our people to return to the wearing of masks and face covering in public. We ask that they maintain the social distancing protocols, that they continue to sanitize, respect the hours of the curfew, apply to the Commissioner of Police for permission to host events and gathering beyond 20 persons, whether that event is a beach party or a private home. And I want to make this abundantly clear, because when we talk about social events, it is in the minds of most of our people that a social event is an event that you have in a public place. But the Act does provide for you to receive permission to have events that are occurring on beaches and in your private homes if those gatherings would exceed 20 persons. We thank our Grenadian population and those who have visited with us during the past year for their understanding, patience, and cooperation with law enforcement. It was and still is a difficult task that we could not have done alone. But your support and sometimes encouragement have made light work of the enormous efforts we have been called upon to shoulder. We all have our parts to play, and if we play it well, we are confident that we will return to normalcy sooner rather than later. Having heard the statistics provided this morning from medical experts and the danger that we currently face by the small number of people that are vaccinated, it becomes important and critical for law enforcement to continue to enforce the regulations, ensuring that we do not have an outbreak, we do not have a spread that will become difficult to contain. And while many have said, and I've heard it myself, we do not have any COVID in Grenada, so why the authorities are so concerned? I indicated earlier that we have been arresting and charged several non-nationals for entering our country without presenting themselves to establish port of entries. Now it takes just one of these persons to enter undetected, and the fact that we have not been following the protocols, wearing of the mask, etc., if that one person get a hold of us in Grenada, with us not adhering to those protocols, we can only ask God to have mercy on us. Thank you.
Thank you so much, Superintendent Vannie Kerwin. Colleagues, you've heard from the entire panel. It is time for your questions. Who's ready? Good morning. Colleagues, are you ready with your questions?
First off, let me ask the question to you, Superintendent Cohen. As it relates to, you said stiffer penalties going forward, would we or should Grenadians expect persons actually being charged for not wearing the mask? And we're talking about just Grenadians in general, not persons outside of businesses and stuff like that. What about the bus terminal? We keep hearing that persons are complaining that the buses are not to be compliant to the protocols anymore, no more hand sanitizing of passengers and stuff like that. What would the Royal Grenada Police Force be doing about this? And to you, Minister Steele, or the Chief Medical Officer, we're hearing about, well, for the past few weeks, we've been hearing about the vaccination, the vaccine. We have low, we're not close to anywhere to herd immunity. Tell me, we are expecting a lot of UK visitors based on a recent BBC News report, and we are seeing a lot of flights coming in. would you say that Grenadians would be at a higher risk, or we would be at a higher risk of having a COVID-19 outbreak due to what is happening now? We're seeing more persons coming in from abroad.
I just want to make abundantly clear what I have said, because you intimated to stiffer penalties. No, I did not speak of stiffer penalties. I spoke of more visible enforcement. So the penalties are what they are. What's going to happen is that you're going to see more law enforcement presence. Yes, on the bus terminus and through the length and breadth of Grenada, doing our part to enforce the regulation and playing our part in the fight to contain the virus from spreading in Grenada. Yes, sorry about that. Yes, as part of the visibility of our enforcement, you're going to see stricter enforcement on mass adherence. As I indicated, if you go to St. George's now, several persons are walking around without wearing the mask. As I indicated before, we have been very tolerant. We have been speaking a lot. We have been encouraging people to wear the mask. But based on what we are hearing now from the medical experts, it becomes critically important for us to again enforce the mask regulations. And to answer your question definitively, there are going to be tickets for mass. There are going to perhaps, be arrests for violations that are continuing, and you can expect to see, stricter enforcement of the regulations based on what we're hearing and based on where we are heading.
Let me comment on that. Yes, we are seeing an increase of individuals coming to Grenada, especially with our new protocols for fully vaccinated individuals. And significantly on that end is where we are seeing the increase. The region expects sometime in June, I believe, but that's still being discussed, direct flights from the UK. A significant number of people in the UK are vaccinated as well, so that does assist. But yes, as long as people are coming into Grenada, whether it is Grenadians returning home, Grenadians who have found it necessary to have to leave for medical reasons, visit family, whatever it is, and they return, yes, that's how COVID-19 spreads, with the movement of people. And as long as we have a low percentage of individuals vaccinated, we continue to have a high risk of outbreak in Grenada. You are seeing many other countries who have increased their percentage of individuals who are vaccinated. The United States announced, the President himself of the United States announced, that as a result of the level of vaccination in the US, certain measures are able to be eased. We look forward to that date, to be able to ease the restrictions for Superintendent Vonnie Kerwin to come here and say an easement of, and not a stricter enforcement of. We've had numerous conversations with the promoters and owners of establishments who are begging and pleading for some form of easement. And we look forward to that. We are begging and pleading as well to be able to be in that position. The Royal Grenada Police Force has done an amazing job throughout. They've had a difficult job to do before the pandemic, and are now faced with enforcing restrictions that, if we take truly into consideration, are restrictions to keep ourselves healthy. Ourselves, not them alone, ourselves. I see individuals commenting on social media that there are children assembling at bus stops without wearing the mask, and why don't the police do anything about it? Those children have parents. Those children have parents, and those children are quite likely following what their parents are doing. Or, if those parents are responsible, then those children are not listening to their parents. So the message has to be clear. Yes, people are coming in. Yes, with people coming in, the risk is greater. But yes, if we are vaccinated, the risk is less.
Thank you. Nancy Maguire, good morning.
Good morning. I wonder if Dr. Charles could elaborate on these increased cases. You had mentioned that you had some testing and none are COVID, but what are they? Could this be related to the ash? Could you just tell us a little bit more about those tests? And to the superintendent, given the fact that so many people are not wearing masks and businesses are not adhering to the protocols and buses are ignoring the protocols and people generally, you're going to be stepping up. Can you give us a little bit more how you're detail how you're going to do that? As the minister noted that you've already been under a lot of pressure. Thank you.
All right, so with regards to the testing, so when we initially saw the rise in the number of cases of acute respiratory infections, all we are talking about here is a lot of persons coming down with symptoms of the cold. All right, when we observed that the cases were rising, we started testing because we were wondering if we were dealing with COVID, because this is exactly how the disease will present, especially in children. It would just present as a cold or a flu. So we started testing using both antigen and PCR tests for COVID-19, which were negative. But we have started running additional tests with the assistance of St. Augustine's Medical Center, and we were able to identify rhinovirus so far. But we need to do more testing to see if this is the only pathogen that is causing this rise in respiratory cases. And by way of information, rhinovirus is the most common virus that causes the common cold. But like I say, what this is a signal. This is an acute respiratory infection. It is spread from person to person by droplets that are released into the air when persons cough or sneeze or laugh or sing or so. It points to the fact that persons are not wearing masks. But in addition, it is spread by contact, by bringing contaminated hands to your eyes, nose, or mouth. So it signals, in addition, that persons are not sanitizing. And these are two significant factors that will assist even the COVID virus in spreading quickly throughout our population. All right, and that is what this situation tells us. Thank you.
Thank you for your...
Could it be related to the ash from the volcano?
No, we have no indication that it is related to the ash, because if you notice, it has come sometime after the ash has left our atmosphere, and really Grenada did not suffer any have any substantial amount of ash in its environment to cause any kind of respiratory condition. Now, in addition, these persons are presenting with fever and runny nose and sore throat and cough and so on, which are signs of an infection. All right, you would expect that with ash, it would aggravate conditions that are more the type of thing like, let's say, asthma, where persons may have coughing and wheezing and maybe some congestion, but not necessarily fever. Fever is a sign that the persons have an infection.
Thank you for your question, Nancy. I did not work with quite a lot of the statistics with me this morning, but let me indicate here that in recent times we have issued several tickets for non-compliance. We have already stepped up our enforcement. We just thought it was necessary to inform the nation and the public, so you are aware that when we stop you, when you get a ticket, you were warned. So we have already started. In recent days or in recent weeks, we have issued quite a lot of fixed penalty tickets. I have seen and heard the comments from people that law enforcement are not serious because we're seeing so many people violating and we are not doing anything. And that's the reason why we are here making the clarion call this morning, because we cannot, in truth and in fact, we cannot respond to every citizen who decides not to wear a mask. All right? And that's the reason why we're asking for compliance. So if we have to enforce the regulation against every citizen, it means that that's all we would have to be doing on a daily basis. But remember, COVID does not end law enforcement responses in Grenada. We still do have all of our law enforcement responsibilities to adhere to. We still have break-ins, we still have crime, we still have traffic violation and traffic management. There is so much going on. And that's the reason why over the last couple of months we have been but we have been saying to our population, please work with us here. Give us an opportunity to attend to the most serious issues in our nation. If you wear your mask, we don't have to take the time to enforce the regulation against you, and we can use those resources, into better areas. But when you don't wear the mask, and a lot of our resources have to be directed towards doing that, then we are leaving other areas, of responses, without the responses that they deserve and demand. So yes, we have already started, and to answer you specifically, tickets have already been increased, and we're going to continue to do that. So if you see people walking around without a mask, that doesn't mean that we have not taken and will continue to take action against those who continue to violate.
Nancy, that's it for the time being?
I just wanted to ask the superintendent to comment as well on the situation in businesses, especially grocery stores, and on the buses. What are you going to be doing with the bus drivers and operators that just allow all these people onto their bus, do not sanitize? How are you going to handle that? Thank you, Superintendent.
Nancy, here is where I think every one of us should play our part. I indicated that, in my opening salvo. Far too often, Grenadians sit by and wait for law enforcement to enforce. But remember, we all have a stake in this. You get on a bus, and 95% of the passengers on the bus are not wearing a mask, but you're getting on that same bus, and you expect law enforcement to stop and give everyone a ticket. Have you said, I'm not speaking about you directly, but have you said anything to the driver? Have you said anything to the passenger? Have you said anything to the conductor? But yet you participate by being a passenger. And here is where we're calling all Grenadians to work together. This is a virus that affects us as a country. And unless and until we all play our part, we will not be able to rid Grenada of the scourge of the virus. And so while we in law enforcement are playing our part, and as I indicated, Nancy, we are going to be stepping up issuance of tickets, we're going to be stepping up enforcement of the regulations, we ask all Grenadians to work with us. Don't participate in the violation and then sit and say law enforcement is doing nothing about it. What are you doing? What am I doing? What are we all doing as Grenadians? It's a collective effort, a collective response, and that's the only way we can rid Grenada of the virus.
Superintendent, I have another question here for you from MTV. So we've addressed the issue of the buses and people not wearing masks, but they're also asking about for the business places that are not following the rules right now in terms of ensuring that people are sanitizing and writing their names. Apparently it has dropped off for some businesses.
Here again is where I make a clarion call for support, and because when we started, when COVID regulation came out, we have had immense support from the public. We have had people calling into police stations, calling into the community relations department, telling us of violations that they have seen, and we have been acting and working on most of these violations that have been reported to us. Now, I indicated before, we are only 1,100 strong, and we are policing a population of 110,000. It means, therefore, that we cannot be everywhere at every time. And so we expect you, members of the public, to let us know what the is happening in your location so that we can properly respond. Businesses that have not been adhering to the protocol in many of the communities that I know, law enforcement will go there. You'll see more police presence, even in some of the rural areas. And we have been attending to some of those businesses, but we will not see all. We will not know of all of them. And that's where you come in, to let us know what you're seeing, let us know who the violators are, and give us an opportunity to deal with them, in the interest of all of us. So we all again have our part to play, and I continue to stress that.
Thank you very much. Good morning, Anisha. Good morning. Nisha, are you there? Good morning. If not, can we move on to Callistra?
Good.
All right, go ahead, Nisha.
Good morning. Are you hearing me?
Yes, we are. Go right ahead.
Good morning to everyone. My question to the panel. We're being reminded that we're under a state of emergency. However, there are concerns being expressed that according to Section 4 of the Grenada Constitution, the authorities can infringe on either one of two fundamental rights during a state of emergency, which is Section 3, it says the right to liberty, and Section 13, freedom from discrimination. The view that our rights are already being infringed upon under Section 3, which is the right to liberty, is can the authority now enforce laws which discriminates against an individual? In terms of, for example, an employer saying to an employee, if they are not vaccinated, they cannot work. And there are laws that if we don't wear masks, we cannot access services and so on. If you're already discriminating under Section 13, you cannot deprive liberty under Section 3. The question is also, is the Constitution being respected during the pandemic upon as outlined in Section? Thank you.
Well, let me comment on that. We don't have a representative from the bar or the Attorney General's office here. But what has been clearly said by the Attorney General, and what is clear in the Constitution, that no one has, in the exercising of any individual right, you cannot do so at the jeopardy of others. You cannot put others at risk. The Constitution does not allow you to put others at risk in exercising your right. So if you want to exercise your right to not take the vaccine, you cannot put others at risk, your employer or your fellow workers who have taken the vaccine. If you want to not wear the mask, you cannot put others at risk by expecting to go out in public or to enter business places, public places or so without wearing the mask. So I think the Constitution is very clear on that, and you don't need a state of emergency for that. You can't just decide you are free to drive once you have a driver's license, but you can't decide that you're going to drive on the other side of the road. And you can't, in exercising your right to drive, you can't drive over the speed limit and put others at risk. So it's very clear that in exercising of your rights, you have a right to do so, but not at the jeopardy of the others. So I think that is what needs to be looked at with respect to employers exercising their right as well to a safe environment and wanting a safe environment for their employees and their customers, and an individual deciding to exercise their right not to take the vaccine cannot put everybody else at jeopardy. So they cannot, don't take the vaccine if you don't want to. But you don't have a right to now enter and put everybody else at risk in the workplace.
Thank you, Minister. Nisha, is that it for you?
I just have a follow-up question. Would you say that the state of emergency is governed by the Constitution?
Yes, the state of emergency is governed. All laws in Grenada are governed by or controlled. I'm not the lawyer again, but the primary and most important law in Grenada, or laws are our constitution, and everything else flows from that.
Good morning, Callistra.
Good morning. Thank you. Morning, Minister. How improved are our capabilities to treat COVID-19 infections in Grenada? We've had a year. Any new medicines available within our arsenal, equipment, space, and so on? What improvements have we made so that we can treat COVID patients if and when the time comes that we open up and we are seeing infections? And also, what are the specifics that will be employed to deal with the problem at the bus terminus? I heard Superintendent Cowan said that citizens should help police the situation in a way to help, and we're participating in it. And I would want to, while asking my question, I would also beg to differ, Superintendent Cowan, that you're putting citizens' lives at risk when you ask them to intervene with others, to ask them to wear their masks or so. I have called the police a few times for buses before entering the buses, or waited on a personal level, and it's not working. The police officers are out there ticketing Grand Dance bus drivers for picking up one or two passengers in the middle of town, while buses are driving off with 4 people in a seat, not wearing masks, not sanitizing. Hundreds of school children gathered there. It only takes one hotel worker to infect their Form 3 student, and then that virus can go across points of the country within an hour. So what's going to be happening at the bus terminus? Are we simply going to give over compliance to keeping the peace in the country? And also, have we improved our capabilities to treat COVID?
Yeah, Callistra, that was a long second part on the question, but I give you that because I appreciate the direction that you're taking there. With respect to what improvements we have made, I mean, Dr. Sean, Charles, you can back me up on this. We are consistently, there are new medicines from when we first started this journey through this pandemic, new treatments, new lessons. But I think what is significant, and I want to be quite clear on that, while we have done and will continue to do everything possible to boost our ability to deal with individuals who would succumb or may succumb to COVID-19 and end up in hospital, we need to be totally transparent and realistic that we are seeing other countries with hundreds or thousands of times better resources than ours fail and have failed. So I think we need to be very clear with each other that no matter how much we improve our facilities at our various healthcare centers, General Hospital and the other 2 hospitals, Princess Alice and Princess Royal, that if COVID-19 does break out, as we have seen it break out in other countries, those facilities will become inundated. So I want to be quite clear with that. So we can speak to the improvements, we can speak to the increased experience that we're learning from our neighboring islands and the world at large in treating. And as we get that information and we learn from others who are themselves in the middle of an outbreak like we're seeing now in Trinidad. So we are learning as well, and we are making adjustments as we learn from what's happening in Trinidad as well. And those adjustments will be done here. But the one common thread throughout is that once COVID-19 does break out in a country significantly, there is yet to have been a healthcare system that has been able to deal with it properly. So let's just be very clear with that. With respect to the question, I think it would be to the police, but I just want to add to that he has clearly said, and I want to remind everyone, the police cannot be everywhere every time. We are very much aware of the police responding when called upon. And we're also very much aware of the police being unable to respond in a timely manner sometimes when called upon. But I want to make a call to for instance, you, Callistra. You have consistently had an issue with the bus terminus and the amount of persons circulating there without wearing the mask. And I agree with you there. And it is quite obvious that the police alone are not what's needed. So quite likely members of the media need to do some exposés and expose the individuals. Expose the individuals who are putting us all at risk, who are putting our children at risk, who have no choice but to pass through the bus terminus to get to school and to get home. And put that out there. Ask the bus associations as journalists, why aren't they doing more enforcement of it? Why do they choose to allow their members to put us at risk? And why do we all have to just only rely on the police? And why can't we rely on our own conscience and our ability to conform to the better good?
I think the minister has addressed the answer to the question that Ms. Faria has asked. All I would wish to add to that is to say that we do not discuss strategies in public. It is a known fact. I've said that several times in many of programs before, that police don't discuss strategies in public. I am sure there are over 1,000 buses at the bus terminus. I'm sure about that. And on a daily basis, you can count on your hand the number of police officers that are in the bus terminus. So the minister has gotten it absolutely correct. We cannot be everywhere at every time doing enforcement for all of the violations, that becomes apparent. And so it is again the clarion call for us to work together. Other entities, other organizations need to step up to the plate. I think Grenadians have left enforcement of the COVID regulation to law enforcement. While it is our primary responsibility to do that, we continue to say from day one that we cannot do this alone. All of us need to get on board. At the end of the day, it's our country, our safety, and our security we're all fighting for.
GBN, do you have another question?
So, Leslie, I'm sorry, but this is my first go around, and I have one more question. If you would indulge me,
yeah, sure. Go ahead.
Superintendent Cowan, does that mean we won't see police presence inside of the bus terminus? We know that sometimes the presence of the police in itself is a deterrent. The issue is the bus drivers, yes, but the students are not going home after school. They're crowding the bus terminus. They're compounding the problem. But there is, and I can say so confidently, there is never a police officer inside of there. The police officers are lined up along Melville Street. Their duty is traffic. Their duty is not acting as a deterrent to COVID violations, because they're not there where the violations are taking place, and they simply their presence can make a difference. So can we see, is it being, I'm not asking you to give me details of strategy, that would be sensitive, although I don't see how, but is anything planned for that, or are we simply going to leave that situation to resolve itself and leave it up to this responsible nature of the Grenadian citizen to deal with that?
I did indicate, Callistra, that as part of our visible enforcement, you're likely to see more police officers on the street, and that would include the bus terminus.
Callistra, I want to add, don't give up on that situation. I really do appreciate the fact that you consistently bring it to the forefront. I think what we are saying is that obviously we need to be doing more collectively. It's within the schools, with parents, and being responsible as you are doing now, and highlighting that problem and saying that the problem needs to be addressed. All we're saying is that it's just not purely the police to do so.
Do you have another, Callistra, or is that it?
Well, thank you, Leslie.
Okay, no problem. GBN, do you have another question? We're getting ready to wrap things up.
Yes, I have a question, but not too much. Minister Steele, you spoke earlier on about the availability of vaccines going forward. Could you tell me, if Grenadians do not take advantage of the vaccines we have presently and they expire, would that affect our ability to source more from other sources, understanding that India has stopped the exportation of the AstraZeneca vaccine? And with that being said, how is that affecting us, the fact that India has stopped the exportation. And to you, Dr. Charles, CDC says that COVID-19 is now airborne and can be transmitted. Now, transmitted more than the 6 feet distance. How does that affect our protocol as well? And Mr. Cohen, I know I just have one question for you. You spoke about arresting non-nationals. Could you tell us are most recent? I know we heard of them prior, but are you speaking about the same set of persons, or do we have any recent? And what are some of the measures we're using to curbing the vehicular accident issue? We have a lot of issues as it relates to that, especially with persons driving without license. That's it.
Well, yes, with respect to vaccine procurement, having a slower rate of vaccination or vaccine uptake means that in the replacements we have to order in smaller amounts. Grenada's national demand is already a very small amount to be ordering, and we had to do it coordinated with the other OECS and CARICOM countries and with Pan American Health Organization. So a slower uptake means that we have to order in smaller batches, because the vaccines have a shelf life or expiration date, so too will the new ones that we order. And also, certain facilities like the COVAX are going to be a bit slower to respond to us. Because especially if by the end of June we have not used all of the vaccines that they have allocated to us. You will see other countries in the region like Trinidad or Barbados that have a much higher vaccine uptake, getting their second shipment from COVAX before we possibly get our shipment from COVAX because of our slow vaccine uptake. So what we are actually end up doing as a people united is delaying our ability to get out of COVID-19 because of the dissenters to vaccination, delaying the ability of a government to remove as a state of emergency, delaying the ability of us to be able to travel as normal on our buses without fare. Delaying the ability of the police to be able to respond to all of the other law enforcement issues that they should be responding to. All of these things are hinged on us getting past this final hurdle, which is vaccination. And you will see other countries. So it's not just my word. Look at other countries as they get to the level of vaccination that has been preset. We need 60,000 people to be fully vaccinated here in Grenada. Each country has its magic number based on the size of its population. And once it gets there, and as it approaches there, you will see an easing of all of the restrictions bit by bit. And that's what we would like to achieve as well.
With regards to your second question, when CDC says that COVID is airborne, it simply means that the virus remains suspended in the air on very tiny particles that can linger for a longer period of time and that can travel on air currents a longer distance. What does it mean for us? It means that persons need to wear their masks. Those particles need to make their way into the air. They do that when persons cough and sneeze and talk and sing and laugh without wearing a mask. All right, to combat the spread by aerosols or by airborne means, it means that persons have to wear their mask. So it means that the person in the room with you that does not have a mask, or the person who was in the room a short while before, if that person was infected and they put those aerosols in the air, they are the one that contaminated the entire room. All right, that is what it means. It means that we have to be more disciplined with mask wearing.
I think there was a component of the questions that were directed to me in relation to recent arrest of non-nationals. I indicated earlier on that I did not work with the statistics, but to answer you, yes, we have had recent arrests, and as I indicated, we will continue. Grenada is attracting quite a number of non-nationals for different reasons. We are one of the safest destinations in the world, not only crime-wise, but COVID-wise as well. And so you can see why people would want to gravitate towards Grenada. We're safe here, both, talking about crime and criminal elements, and we are also, a lot safer than some of the other islands when it comes to COVID. So for these reasons, people will continue to come, and we will continue to make arrests. But bear in mind that maybe for every one person we arrest, there might be 2 or 3 that are undetected, and that is where the fear really is. To answer your second question on motor vehicle accidents, this is alarming. It is alarming. And we don't know, what more can be done, because we believe we have done everything that is needed to be done to educate our population. We have been on radio and television, we've had programs. Everything that we could have done as it relates to the reduction of motor vehicular accidents, we have been doing it. I was appalled about a week or 2 ago when our head of traffic department, Superintendent Connaught, announced that we have seen accidents in a 5-day period that equal accidents that we have been seeing for 3 months collectively. We have had, I think it's over 800 and something accidents. Don't quote me on the figure. I'm not specific in it, but I can always get that figure for you. But what he has indicated is that what we have seen in a 5-day period equal to what we have been seeing in 3 months. It means that the message that we are sending out, all of the advice and information is not being adhered to. Is not being adhered to. We spoke about distracted driving and speeding and using your cell phones and eating while you're driving. And these are constant program that we've been having, educating the public, and yet our accident rates are continuing to rise. So unless something magical happened, I do not know how we are going to reduce our accidents, because we believe we are doing everything we know how to do. It's just the population are not adhering to the advice that we are putting out there, and they continue to do their own thing and put all of us at risk on our nation's road.
Colleagues, thank you very much. We've reached the 1 hour mark, so we have to wrap things up right now. Is there anybody else with a very quick question? 10 seconds. Nobody?
Yes.
Who's it, Callistra?
Okay, thank you.
Go ahead.
I know the Prime Minister, I think I read somewhere that the Prime Minister met with promoters at some point over the last couple of months. Any plans to give permission again for events at the stadium where there is a lot of space, and we're having issues of physical social distancing being violated in our places? In the stadium, it might be easier to control. Are we looking at, is there a time frame on allowing activities in the stadium again?
Yep, Callistra, there have been discussions since then, and yes, we are trying to find a way, and some of the promoters have actually put forward additional proposals since then, in particular to having a what they refer to as a fully vaccinated event, where all of the individuals, that they would be granted additional numbers of persons in whatever facility, provided that all of these persons are fully vaccinated, and that we acknowledge, and we're looking at that, as well as, because we understand that the promoters have been hurting as well during this period. And we have consistently said that we attempt as best as possible to find a balance between lives and livelihoods. So we would like to get to that. We can get to that faster through vaccination. Between now and then, we are going to have to find, wherever possible, ways to compromise, to allow certain activities to occur while keeping us as safe as possible. Why I say as safe as possible, because the safest is to not have those activities, but we have to find that compromise. So yes, the discussion continues, and I do look forward to us being able to, in the next couple of days or so maybe, with consultation with the COVID committee and the approval from Cabinet for us to have some forms of events, larger events with the promoters, keeping it as safe as possible.
Right, it's Nancy Maguire. The final question goes to you, and then I'll take closing comments from the panel. Nancy, go quickly.
Thank you. I always ask this question, so I'll ask it. When will we be able to have a breakdown of who has taken the vaccine in terms of categories, age, and that sort of thing? I think that would help us reach out to people. Thank you.
Nancy, we will attempt to get that information for you, but I think what we need to recognize is that COVID doesn't respect any of those breakdowns. Every single person is at risk. We need to recognize that certain professions and certain forms of employment are at a higher level of risk, and the ministry has identified those. We have started the inspection of quarantine sites, and they will very quickly be delisted if they are not fully vaccinated, fully first dose or fully second dose. Right now, enough time has passed that we think it is in the public interest to ensure that anyone interacting with a quarantine site, so that would be anyone doing housekeeping, security, food and beverage preparations, etc., front desk check-in, etc., should be fully vaccinated. Otherwise, they're putting the community at risk, and those sites will have to choose either to remain as quarantine sites or to be delisted as quarantine sites. To remain as quarantine sites, there must be 100% vaccination of all persons employed there. And the ministry, through the CMO and the powers there, and in seeking the best interest of the safety of the country, in keeping COVID-19 out of the country as best as possible, we have to take those measures. The institutions have been informed, and we will continue to inform and inspect institutions. So the breakdown, no, we do not have that breakdown, because every day there are hundreds of persons getting vaccinated, but that isn't an excuse. I think what we just need to be sure of is each one tell one, each one bring one. We need everybody, not just all of our doctors, all of our police officers, all of our hospitality sector. We need 60,000. There is no specific sector in Grenada that's just 60,000 alone. That means we need all of us to be vaccinated. We need to recognize if we have someone at home who is at high risk, and therefore we need to be vaccinated. We need to recognize that there are some of us who cannot take the vaccine, that may want to and need to take the vaccine and should. So anyone under 18 cannot take the vaccine. So we have to do what is right to safeguard them. We have certain persons with existing conditions that, yes, they cannot take the vaccine either. But those existing conditions quite likely means that they are at a much greater risk of dying if they do get COVID-19 as well. So that's why we need to protect them as well.
Thank you very much, colleagues. Gentlemen, lady, final words from you. I'll start with Superintendent Kerwin, then we'll go to Dr. Mariana Charles, Dr. Sean Charles, and finally from the Honorable Minister.
In closing, I'll continue to say to the general public that we need to work together. We thank you for what you have done with us over the last year plus. The cooperation that we have seen, the tolerance that you have exhibited, we welcome that. We ask that you continue to work with law enforcement as we continue to work with all our partners to ensure that we play our part in the fight against COVID-19. Thank you.
In closing, I would like to encourage everyone to use the tools that is available to us. Right? Let's continue to abide by the public health measures set forth. Let's continue to wear our masks properly, covering our nose and our mouth. Continue to sanitize, continue to social distance, and let us get vaccinated. Remember, COVID-19, there is no medication nowhere in the world that can cure COVID-19 if you get COVID-19. Right? The goal of treatment of COVID-19 is to manage the symptoms until you recover. And as we have seen the global statistics, not everyone recovers. Right? There has been over 3 million deaths. So let's not play Russian roulette with our lives. Let's not make the comment saying, I'll take my chances with COVID, because we do not know how we would react. And remember, there is no medication in the world that cures COVID. Right? So let us take the safe and effective measure, and that is vaccination. What do we know about vaccination? It protects us from severe illness. It protects us from death. It protects us from hospitalization. And this right now is a priority for every country worldwide and is one of the most effective tools in ending this pandemic, along with our public health measures. So I want to encourage everyone in the general public to play their part. It is not my fight. It is not minister's fight. It is our fight. Right? So let us continue to play our part in the fight against COVID-19.
Well, in closing, I would just like to say that at least from our end at the Ministry of Health, we have many reasons to be concerned. We have seen COVID overwhelm public health systems that are much more advanced than ours, much better resourced than ours, and they have simply been brought to their knees, taken to their breaking point. I think we all need to just forget whatever tiny differences that we have, and we need to work together if we are to survive this pandemic. Because at the end of the day, I can tell you this virus does not care what are your interests, your preferences, whatever rights you may prescribe to. Whatever complaints or beliefs you have, your age, your sex, your status, this virus does not care either way. It is an equal opportunity pathogen. We ask everyone to be responsible, follow the protocols, get vaccinated. That's the only way that we are all going to get through this safely. Thank you.
Thank you. Honorable Minister.
Yeah, thank you. I just want to again thank those of our leaders in society who have made statements and want to encourage you to continue to make statements. They are labor leaders, political leaders. We have seen clear statements being made by our NDC party. We have seen clear statements being made by religious leaders supporting and encouraging individuals to exercise their right to take the vaccine, to exercise their right to be as safe as possible. I want to thank those who have made those statements and encourage them to continue, because it is most obvious that it takes more than one statement. We need to be our brother's keepers and encourage each and every one of our members, whatever that entity is, to come forward and to take the vaccine. COVID-19 does not respect politics, religion, or any affiliation or grouping. It will just make sure that if you are assembled together, that it will spread as quickly as possible among those who are assembled not following protocols. But it really doesn't care what beliefs, who you like, who you don't like, whether you support the government, do not support the government, whether you like the minister, don't like the minister, whether you practice your religion or don't practice your religion. It does not respect any of those things. We have been successful with everything that we have done with COVID so far, but we are coming here today to say that we have not been successful with the vaccination program with respect to the uptake, and that is a collective failure on us all. That is not just the Ministry of Health. I am here to say that we have not been successful, but that is a collective national failure, because it takes all of us. It takes every single entity. And those who have made statements, we have heard statements from our political parties, we have heard statements from the NDC, we have heard statements from labor leaders. They have participated with us in forums. We have heard statements from religious leaders as well. But we are very much aware that there are some out there who continue to one, exercise their right not to take it, but then infringe on the rights of others by trying to convince them not to take it and to prevent the country from moving forward, delaying this whole process of state of emergency, delaying the whole process of us having to wear the mask, delaying the whole process of us not being able to have events, delaying the whole process of people being in quarantine coming in when they visit or when they return to Grenada as Grenadian nationals in their own country, delaying the process of persons having to have the inconvenience of being swabbed. 11 million EC dollars has been spent on just tests alone for this pandemic that could have been used elsewhere. So we need to come forward. We need to take the vaccine. We need to get past this so that we can start talking about national health insurance, so we can start talking about non-communicable diseases, so we can start talking about reducing the percentage of diabetes here, so we can start talking about assisting people with dialysis, the many other health challenges, so we can start talking about our various health centers being improved. All of this we need to discuss so that police can start talking about other parts of law enforcement as well, moving forward. And the way to do this is with vaccination, and regrettably, right now, our stocks of vaccination will only be viable until the 27th of June. So please, if you have been hesitating and you're almost there, please come forward, because we would hate to be in a position which we think is very possible, that somewhere between now and the 27th of June or after the 27th of June, we have an outbreak. And at that point, you're ready to take the vaccine to protect yourselves and your family, but we will not have available. Thank you.
Thank you, Honourable Minister. So, colleagues, viewers, we've heard from the panel here this morning, Minister for Health and Social Security, the Honourable Nicholas Steele, Chief Medical Officer, Dr. Sean Charles, as well as the Assistant to the CMO, Dr. Mayana Charles, and Superintendent Vani Kerwin, who is in charge of Community Relations. We've heard it all before, and we've heard it again. Let us do what we have to do to ensure that we protect ourselves, our family, our neighbours, and our country as well. For those of you not wearing masks in public, not because we have one case means that you can just be complacent. We have to continue to ensure that we protect ourselves. It's our fundamental right to protect ourselves. If we're not doing that, then we're not doing what we're supposed to be doing. So please, let us be as cautious as possible going forward. And if you have not taken the vaccine yet, now is the time to do so. Stop hemming and hawing, and let's do what we have to do. So for all our colleagues joining us via Zoom, our viewers on Channel 22, the Facebook page and YouTube channel, and of course those of you in the diaspora, thank you so much for being with us. Have a blessed day, everybody. Thank you.